Welcome to Live Pure, the podcast. I'm your hostess, Janelle Alexandra. Get comfy, settle in, as we discuss all things health and well-being. Be sure to like, share, and subscribe. Now, let's get to talking about living pure. Hi, welcome back. Today I'm here with my friend, Dr. Mark Burdorf. He is a chiropractor neurologist, and he started off as a chiropractor, went back to neurology. He's been here in Arizona for 35 years, and we're going to talk a little bit about the brain and a lot of sciencey words, so pay attention. Mark, how are you today?
I'm great. Thank you for having me.
Do you want to expand a little bit more about your background and what you do for people here in Arizona?
Yeah, I grew up in Minnesota, and I went to chiropractic college in Minnesota. I practiced in Minnesota for a year, had the opportunity to move out to Arizona, worked for another general chiropractor for a 3-year deal, and I was seriously thinking of quitting chiropractic and going to law school.
Oh, yikes.
And I was just kind of bored, and I went to an intro to neurology seminar. Dr. Ted Carrick's my neurology professor, and it changed my life. And so I went on and became, I did my neurology at USC, and there's 8 of us that are chironeuros in the state. And we all kind of practice the same way. And I kind of fell into this, but I see a lot of combat athletes that are UFC guys, boxers. So my main focus is brain and neck injuries. So,
which I have both of those. So.
Yeah. And I have my own little science project because I have my own share of issues. I got herniated disc in my neck and back from some accidents. And neurology is complex, but if you follow me for 2 rules, I'll take you a long way.
Okay.
And the first rule is everything is sensory in, and then it's a motor response back out. And your primary senses are your eyes, your ears, taste, temperature, touch. And touch receptors, there's many, but just remember there's 2, okay? And this is the pain model. So like, let's say you have a problem here. One nerve's going to go to your brain, tell you about it. The other nerve, if I activate, it's going to block that pain. The other nerve is also going to affect 3 big factors. How strong you are as far as muscle tone. It's going to affect balance. It's going to affect circulation. So the reality is what hurts to Mark may not hurt to Janelle. So I see a lot of people that don't necessarily have pain per se, but they have changes in balance and muscle tone.
Yeah, like atrophy. I'm thinking atrophy for sure.
Yeah, and then they get the dys word, so you have like dysautonomia because there's a part of your nervous system, like I said, affects blood vessel tone, and that's where you have 12 cranial nerves, and cranial nerves 3, 4, and 6 affect eye movements, and then cranial nerves 3, 5, 7, 9, and 10 all affect blood vessel tone. Okay, and cranial nerve 10 is the vagus nerve, and it's not VEGUS, it's VAG, and it's VEGAS, it's VAGUS. Okay, and don't think of the vagus as a bad guy. It's just most of the other cranial nerves all exist in your brain, and the unique thing about the vagus nerve is it has branches that go all the way down into your pelvic floor.
And that's the one that we're finding more devices that stimulate right
now. Yeah.
I know my lymphatic machine does that. We can stimulate.
Yeah. There's probably about a half dozen things out there that can use it. There's a guy named Nick Hoole, and he's local, and he was a really good golfer, and he was ASU scholarship, and then he wanted to turn pro, and he developed such severe anxiety he had to quit. Now, the good news is he's a biomechanical engineer, so he developed this little device that one of the branches of the vagus nerve is his superior auricular branch, and it goes through what a foramen is a big hole in your head. Okay, so the foramen magnum is the big guy, and that's where your spinal cord goes. But the jugular foramen is where this guy goes. And there's about a half dozen little handheld things, and it's called Hoolist, and it's manufactured locally. And what you can do is you can put this on there, and it'll calm your nervous system down. And just to kind of jump in, when we talk about the autonomic nervous system, there's 2 parts to it. It's parasympathetic and sympathetic. And sympathetic is I'm going to fight you, Janelle, or I'm going to run away. Okay, parasympathetic is just think rest.
Is that also the fawning one too, where you freeze as well? Is that part of that system?
Exactly.
Okay.
And you see that's the whole thing. It's like, and don't think of the vagus as a bad guy, and don't think of parasympathetic or sympathetic as bad either. It's just they need to be balanced. And the thing is, if you're in a constant sympathetic storm, as we say, that's where the anxiety all comes from. So what this device does, just like your device in your office does, is has a stimulating effect or an activating effect to the parasympathetic aspect to inhibit the sympathetic and help it to be calm. And that helps reduce anxiety, stuff like that.
Interesting.
I was thinking maybe we just spend a few minutes of like how the brain and nervous system develop.
Yeah, give us the whole rundown, because
Okay.
I don't think a whole lot of people truly understand how important all of that truly is for
Okay.
the functioning of our entire body.
Okay. Well, once upon a time, my mom and dad got together, and the sperm and the egg created something called the zygote. Okay. And the zygote then differentiated into they're called derm layers. And the first one is ectoderm, which is brain, spinal cord. Endoderm is basically all your organs and your digestive tract, and then mesoderm is your muscles and skeleton. So for my case, once upon a time, those three were all brothers, just like there's all three sisters for you. Okay, so what happens then is as we look at higher brain function, we have there's four different parts. One's called the telencephalon, which goes on to become your frontal lobe. Okay, the diencephalon, which we talked a little bit about something called the pituitary gland.
I feel like I'm getting a review here, and this is really nice, so thank you.
Okay, so the pituitary gland is part of the diencephalon, and what's interesting is there's four little parts of the diencephalon, but the big one is the thalamus.
Yeah.
Okay, and when we start looking at pathways, and the whole thing is, chiropractors in general have misinformed patients over the years about a pinched nerve. Okay, if you truly have a pinched nerve, you need a cortisone shot or you need surgery.
It's like constant pain. It's not just this little...
Well, pain is pain. Okay, you can have three people that have pain down their arm, and one can have a true pinched nerve, which requires a surgery or a cortisone shot. The second can be a joint issue, which is a chiropractic application or physical therapy application, and then the third one you could be having a heart attack.
Oh my gosh.
So it could be vascular. So you can have three people, the same symptoms, three different causes.
Okay.
But anyway, so getting back to now we start talking about sensory motor and the two rules of neurology is if I activate my hand, that's the primary. The secondary neuron is then my cerebellum, and the tertiary neuron is my thalamus. And that's then the thalamus feeds forward into the various lobes of your brain that then tell you things. And then since we're talking about brain right now, your frontal lobe is your personality and behavior. Your temporal lobe has to do with short, long-term memory as well as hearing. And your parietal lobe is sensory motor, which is pain and suffering. And then your occipital lobe obviously has to do with vision. Okay? And then hemisphere side, hemisphericity means the side that doesn't work as well.
Okay.
So like a lot of times we will do, and everything we do is activate, because we're trying to activate stuff to cause inhibition. And now the third of the four parts of your brain is the mesencephalon. And the mesencephalon is excitatory to everything. And I know you have a son, and you probably when he was an infant, he probably put a fetal heart rate monitor on him, and his heart rate was probably 150, 180 beats a minute. Remember that?
I guess.
Okay,
That was
it
such a
was.
long time ago.
Oh, no. Well, no, but that's because at that time the mesencephalon was just basically controlling all the pathways, and that's why the heart rate was very high.
Okay.
And then as your brain develops, which your telencephalon becomes your frontal lobe, the frontal lobe creates the inhibition. And that's what causes your heart rate when you're a little baby or a little infant to be 150 over 180 to start slowing down into hopefully that 60, 70 range. Okay? And then the problem is as we age, when your brain starts to deteriorate, especially your frontal lobe, that inhibition is lost. So what happens? Heart rate starts to go up again. Mm-hmm. And when you keep having a high heart rate over a long period of time, that's why a hummingbird that's got that really fast heart rate, they don't live long. And that's what basically...
That's like all the small animals, they beat faster. Okay.
Yeah, cardiovascular
I'm thinking of
disease
rabbits.
develops, yeah. And then the last part we were talking is a rhombencephalon. And basically the pons medulla and the cerebellum all have like inhibition. And the cerebellum, even though it's 80%, even though it's only 10% volume of the brain, it's got 80% of the neurons. Okay, so now that I've kind of gave you a little idea of the different aspects of brain and how it all developed, now let's talk about how disease happens, and then what can we do to maybe change it.
Yeah,
Okay.
that's the important part.
And so I'm just going to kind of jump into, and this is a little bit more physical medicine, neuro, rehab, chiropractic mixed together, laser, all mixed together, is what's going to happen is the three parts of your brain that affect balance, okay, and postural muscle tone is your eyes, your inner ear, which is your vestibular system, your cerebellum. Okay, so eyes is visual, and we were kind of talking earlier about how the mesencephalon and how the medulla and the cerebellum all work, is we can do eye exercises to activate the brain. Okay, when we talk about the vestibular system, there's three canals. You got the horizontal, the anterior, posterior canals, and a lot of times when people have a concussion, they hit their head, so that becomes the vestibular component. And a lot of times too, I see people that just don't feel right. They feel like, they're a little dizzy, or they see the room spinning and stuff like that. And we were just talking earlier before the podcast about different types of brain tumors. You can have different forms of cardiovascular events, transient ischemic attacks, which is TIAs. You can have a true stroke, and different aspects of your brain. And then after that, there's something called benign paroxysmal positional vertigo. And basically those three canals, just think of the 101. Everybody should be going 65 miles an hour. We have these little rocks or otoliths called, or crystals, and what they do is it's like a car accident, and all of a sudden everything gets bottlenecked. So what happens, those crystals bottle up, and we don't know why it happens, and doctors love to name stuff after themselves. So Dr. Dix, D-I-X, and Hallpike were the guys that figured out this little maneuver that you stick somebody back quickly, extend their head, rotate, look at the ceiling, and if they start developing a flutter of their eyes, which is called nystagmus, that's positive for those crystals. So there's a little maneuver called Epley, who's the doctor. He just fortunately passed a couple of years ago, but he's the guy that flushed those crystals out, and you have to do this maneuver and put their head in position 20, 30 seconds, and then they have to sit up for a day. They can't go to bed. They have to sleep in a recliner, and that's
thank you.
one time fix. Well, that's another aspect. And then go back to our friend the cerebellum. And even like I said, it's only 10% volume of the brain, it's 80% of the neurons. Well, the thing is, most injuries to your neck are cerebellar. In fact, most therapies, like if I adjust you, if I laser you, if I give you an eye exercise, if I give you any kind of an exercise for balance, okay, then what happens? Okay, you fall and hit your head. Your head's attached to your neck. So you have a vestibular injury and a cerebellar injury. It's a double whammy.
Yikes.
Yeah.
And is that kind of the same thing with like car accidents too, where?
Yeah.
Okay.
Yeah, and car accidents, sports injuries, those are big traumas, like
Yeah.
my athletes that I work with. But then you deal with people who are repetitive stress. So those people they're sitting like this all day and that type of stuff. And
So I've had all three then. So I've had multiple car accidents, but I've also ran into things to the point where I actually have a dent in my forehead if you pay attention from like the constant trauma in the same spot over the years. And then just being a parent to a special needs child, when he was younger, I was constantly getting headbutted, where I thought, swollen lips, black eyes, the whole thing. And so I think PTSD developed from just like bracing, waiting for that impact on a regular basis.
Yeah. And so we've talked in a prior conversation about something called biohacking. And biohacking is as doctors, we always have to come up with new words every couple of years. To just
biohacking, biostacking, I think is what I just learned from you. Yeah.
Yeah. So biohacking is basically a term where you do a little change in your life to hopefully juggernaut your health, brain health, maybe nutrition. And then biostacking is when you can stack many things together.
That's what I've been doing the last couple of years.
Yeah.
Almost 3 years now.
And so like one of the hallmarks of what I do is when I diagnose a patient, and we got the three pathways that affect balance, so I got visual, vestibular, cerebellar. What I do is I find the pathway of the three that works the best to rehab the broken ones, okay? And just like we talked about the endoderm and the ectoderm and the mesoderm, well, because they're all brothers and sisters, then what happens is if your brain doesn't work, then your gut doesn't work. If your gut doesn't work, your brain doesn't work, and that can reflect then into your musculoskeletal system. And one of the things too, when we start talking about, okay, what happens? Okay, whether you were in a car accident, whether you served in the military, whether you grew up in a farmland with Monsanto around, these are all different forms of chemical concussions or physical concussions to your brain.
Okay.
And we were talking a little bit earlier where, it's one thing to have a trauma, okay, and if you don't fix it, okay, it may not always be symptomatic, but it does get worse. And the word
So like building scar tissue type of a scenario.
Well, in the musculoskeletal system, but the problem is in the brain, you can basically develop tau protein, and that's where things that promote the deterioration of the brain, especially frontal lobe. We can start talking dementia. Alzheimer's is a form of dementia. You can look at athletes, especially. There's very few. I think Hulk Hogan is the only professional wrestler over the age 65 that's still alive. I mean, the average life expectancy of an NFL football player is 51.
Yikes.
Yeah. And it's like you see it all the time.
Well, I guess that's proof that Hulk was number one.
Yeah, but a lot of these guys, and I mean, professional wrestling is kind of faked, but still they slam a chair against somebody. So I mean, it's trauma, and the problem is when you have trauma, you don't fix it, it deteriorates. That's what degeneration is. In neurology, we call plasticity. Plasticity means you're building it back up. So neuroplasticity is we can incorporate a variety.
That's been a big word lately too.
Yeah. We can incorporate, and that's why I biostack together usually an eye exercise while somebody's doing a balance exercise, and just going back. And I mean, we don't walk around with our eyes closed. But the three parts of our brain that do affect balance is visual, vestibular, cerebellar. We know in neurology that when you stand with your eyes closed on a hard floor, the great majority of sensation is cerebellar, it's somatosensory. If you put somebody on an Eric's balance pad or some sort of a perturbed surface that's unstable, then it becomes mainly vestibular. So that allows me to differentially diagnose what kind of, I can have the same people, several patients with maybe the same symptom, and for one needs an eye exercise, and one needs maybe a balance exercise, and one needs a vestibular exercise. But then as we progress with the therapy, I usually blend it all together.
So it sounds like you customize things based on what people's injuries and needs
Yeah,
are.
I wish I could cookbook this. I can't.
Yeah.
Okay, because it's like, I just like, take this. But it doesn't work that way. And I think we talked about half-lives, haven't we?
A little bit, yeah.
Okay.
Maybe the first time we met.
Yeah, so what a half-life is it means change, okay? And I always tell people, I call it the rule of fours, and just think of drugs, like how long something stays in your body, how quickly it disappears, and it's the rule of fours. It's in the Bible, okay? And if you don't get oxygen to your brain for 4 minutes, you're dead, okay? If you don't drink water for 4 days, probably dehydrated, possibly dead, and somebody threw us in the desert for 40 days, we starve. So now we know that half-lives can be seconds, minutes, days, weeks, months. Half-life of brain is minutes. Okay, half-life of skeletal muscle is roughly a couple weeks. And the best analogy I can give you is, you're strong, you go skiing, you break your arm. The cast that say 6 weeks, well, that's a 2-week progression. When you take the cast off, what happened to the mass of the muscle? Did it get big or little?
They got really little.
Yeah, it's atrophy. So that's where a lot of times, and this is most of us chironeuros, we do short-term treatment plans. I call it a 6-week intensive.
Okay.
So I'm not going to sign you up for this, 3 times a week program for months or whatever. It's just kind of like I'm very aggressive, and what I do is I blend together neuro rehab, as far as the balance exercises, the potential we're going to do to strengthen. And you see, it's not a bad idea to go to the gym and do yoga and Pilates and back exercises are all great, but the muscles that do hold your spine together, they're this little. And they're all
so
control.
little.
Yeah,
our erectors and all, yeah.
Deep intrinsics. And so what happens is they're all in control of eye, vestibular, cerebellar. So like I said, we find the pathway that works to rehab the broken one, and then we try to biostack things together to hopefully create long-term plasticity.
Interesting. I wish I would have met you back in 2017 because that's when I felt ill at first, and I'm calling it adrenal fatigue. We were never really diagnosed with anything specific, but I lost 11 pounds in the first week.
Yeah.
I lost a total of 30 pounds altogether within less than a month, and that was all just muscle loss.
Yeah.
And just getting up and taking a shower was all I could do for the day.
Yeah, and that's the whole thing.
Years.
Gravity is powerful.
Yeah.
You never realize what function's like until you lose it. And let's go back to our friend, the pituitary gland. It's kind of referred to as the master gland because it has so many effects on heart, lung, gut, hormones.
Yeah, that's the one that directs all the hormones.
Yeah.
Yeah.
And so when you have a problem with the brain, if the brain doesn't work, the brain basically controls, and the nervous system controls all organ functions. So that's where you can develop cardiovascular issues. And just because, once again, we go back to our friend, the endo and ecto and mesoderms, is there's something called serotonin. It's a neurotransmitter. And the majority of it's all made in the intestines, mainly the small intestine, which means if your brain doesn't work, your gut doesn't work. If your gut doesn't work, it's not producing serotonin. Okay? And we don't have serotonin, that's something that sets you up for depression and anxiety. A lot of people, too, they develop digestive issues. And, I had my gallbladder taken out.
Oh, I've had so many new clients of that recently.
Yeah. And congratulations. You know what you just did? You lost your ability to digest fats for the rest of your life.
Yeah, so a lot of them end up having to take a certain type of pill before every meal now.
Yeah. Well, they're looking at digestive enzymes. I do nutrition in my practice, and I use several different companies. One I use is called Zymogen. And they have an omega-3. They have a patented technology. It's called micellized, which means it converts it from a fat to a water-soluble formula. Okay, but the thing is, if you don't have a gallbladder, your ability to digest fats is lost, and your major vitamins that are fat-soluble,
which is
are,
A, D, E, and K. Did I get that right? Which
yeah,
Yay,
you're
yay
a
me.
smart girl. Not only pretty, but you're smart. This is awesome. But that's the whole thing. So all those K2 and D3 are both fat soluble, and vitamin D is not even a vitamin; it's a hormone. And the interesting thing about it is people take. This is something really important. Is if you take vitamin D by itself, that's going to be a bad thing. Because the vitamin D goes systemically in your body, which means it not only goes into your bones where it's supposed to be, but it also goes into your blood vessels, which basically creates atherosclerosis, hardening of the arteries.
Ooh,
so
fascinating.
that's why it's super important. If you are going to take supplements, blood work doesn't lie.
Or just go lay out in the sun first thing in the morning.
Nah, it's crazy.
Not the same?
It's not. Well, the problem is if you use sunscreen.
Well, I go out first thing in the morning, like 7:30 to 8:30,
Okay.
with no sunscreen.
Well, all I'm going to say is blood work doesn't lie, and you normally, when blood work, you should have it between 50 and 70, even up to 90 for certain people.
Okay, I get mine back on Monday. I'll see what mine is.
Yeah, well, and that's just blood work. Get your blood work done. I mean, vitamin D is like a $40 test. You know, you can get it done. There's a lot of places self-pay. But anyway, the important thing of why you want to have a K2 D3 combination is think of the K2 as like the conductor on the train. He tells you where to sit. Okay, you go here, I go there. And the thing is, what the K2 does is it basically tells the vitamin D to go into the bones only and not the blood vessels. And that's been an important clinical fact.
How many people are taking a supplement for D without other things?
You'd be surprised.
Really?
Yeah, you'd be surprised. You know, the problem is there's this Dr. Google. And what people do is they, go on Google. The internet has a lot of great information and a lot of misinformation.
Yeah, a lot of misinformation.
Yeah, and then that's where, there's three people in this world. There's people that don't do what they do, and that's what they should, and that's why they develop cancer, heart disease, cognitive decline.
Because they're taking like 30 different supplements every day.
Well, that's the second person.
Okay.
The first person doesn't do anything. The second person is basically listens to Dr. Google, and they're taking a grocery bag of stuff they don't need. And that's where what I do in my practice is I look at your blood work, and I learned Dr. Merkel. He's out of Dayton, Ohio, and I've been doing his work about 15 years. And what I love about him is he's a real put it to the test guy. So what you can do is you can get your blood work, find out what's normal, what's abnormal. I try to limit it to maybe 4 or 5 supplements max, and then we know what a half-life is now. And the half-life of vitamin D is 15 days, which means if let's say your vitamin D level is low, then I'm going to tell you to take Xgenel, and then you can retest your vitamin D level in a couple half-lives, maybe 30, 45 days. Your half-life of your liver is 4 to 6 weeks, which means you can rehab or destroy it in that window of time. That's what rehab is a 30-day program.
I had 2 beers last night for my At this show, I had 2 beers last night, and it ruined my entire nights of sleep.
That's why, because you get that sugar rebound.
Yeah. Oh, so no drinking for me ever again. That's
Yeah.
what I say. And then I go and do something like celebrate my birthday, and I have 2 beers.
No. Well, the wines are actually almost worse with the sugar.
Okay.
What happens is that's why a lot of times you wake up and you can't sleep in the middle of the night.
Yeah, I feel like I slept last night, but my Whoop says that it looked like I was exercising all night long.
Really?
I remember having dreams, but I was dancing in my dreams, so maybe there was the
Well, if
difference
it was a
there.
happy dance. That's a good. But anyway, so the same difference. We're getting back to gut health. So the thing is, there's different supplements you can take to improve your gut health, and I could do a laundry list of stuff, but I'm going to just tell you, it's like I go back to the basic blood panels, and then we're kind of closing out the part. But I mean, now we talk about hormones, and the 3 things, especially once you're over 40, that do affect you is your thyroid, your hormones, your adrenals.
Yeah.
Okay. And so the thing is, a good thyroid panel, and that's where I co-manage a lot of patients with naturopaths.
Now,
functional
my
medicine
thyroid
docs.
panels have come back normal the last 3 times I've had them checked in the last few years. But when I talked to the compound pharmacist, Rudy Dragoni, and he was just here recently, he suggests that you take your temperature first thing in the morning. And if it's running below 98.5, I've been telling people below 98. Mine is at 97.1 when I wake up in the morning. And he says that the lower it is, the more underactive the thyroid is. And so I found that really interesting because for 7 years I had a problem putting weight on, but I did have multiple symptoms of an underactive thyroid. And so now that I've broken my addiction to marijuana, I've been able to put 30 pounds on in just 6 months period.
Okay.
And we're finding that my body fat percentage is definitely higher than what it normally likes to be. So that was one thing that, and I know that like when I massage and I can feel it like clicking and grinding in here even. And that's kind of a new thing for me as well.
Okay. Well, once again, your thyroid can be normal. What are your adrenals? What are your hormones?
Yeah, that's why we decided to do the whole panel.
Yeah, and the whole thing is like adrenals can be checked with something called a cortisol AM. And that can be a mixed bag because if somebody's going, I got a needle, it's like, I'm scared. So there's different ways you can test the adrenals. You can do it with a cortisol AM blood test. Either there's different saliva testing kits you can try out there.
Ooh, saliva. I'm down for trying one of those.
Yeah, and the thing is, it just goes back to put it to the test, okay? And it's just like a speedometer in your car. It's like how fast you're going, your gas gauge, how much gas do you have left, If you get 20 miles to the gallon.
My dad used to shake the car when it was empty just to go a little further.
So, and the problem is we live in a pretty frickin' stressful world. So a lot of times too, if you're that very alpha female or male and you're just gas pedal down all the time, there's a point where you're going to crash. And that's where a lot of times you can have normal hormones, you can have normal thyroid, but if your adrenals are crashed.
And I think that's what happened to me in 2017. And it's
Yeah.
taken me this long to finally, I call it island time, where I feel more relaxed and I'm allowing things to slide a lot easier. I'm not overbooking myself. Like I have very specific boundaries of how many hours I'm working now, and I go home and then I spend it with my son. And
Yeah.
I never used to be that way. I would go from 4 in the morning until 10 o'clock at night till I just literally dropped.
Yeah. Well, I checked my ego a long time ago, and I mean, I got all these neuro degrees behind my name, but I co-manage patients all the time with other healthcare providers. I personally am a big fan of hypnotherapy, and we're getting back into your lower brainstem is something called the reticular formation, and there's many techniques out there that you can do, but I mean, hypnotherapy is a form of relaxation. There's a lot of great motivational speakers out there. Joe Dispenza was a chiropractor that he had an injury and ended his chiropractic career, and he ended up now he's a motivational speaker and he's on, YouTube and all this stuff. I listen to him every night.
Yeah, I don't listen to him every night, but he's good. He's good.
Yeah.
So, all right. Well, I'm going to clearly have to have you back on the show because I feel like we have not we've just scratched the surface, and I love that we're just down the street from each other so that we can constantly network back and forth with each other. And
I would love that.
yeah, so I'm really grateful that you came on the show today, and I hope to have you back soon.
Sounds great.
Thank you.
Thanks for tuning in today. I hope you learned something new about health and well-being. Remember, your current position is not your final destination. Be sure to like, share, and subscribe to our channel. Definitely reach out with questions so we can discuss it in a future episode. Until next time, live pure.